Well, the arrival of the Omicron variant and its typically milder symptoms has many Americans feeling as if the worst of the pandemic is over. But a recent article in The Atlantic paints a very different picture for those on the front lines. Omicron has not, in fact, been milder for the nation's hospitals at all. Healthcare workers already pushed to the brink are now overwhelmed once more by the sheer volume of patients flooding into emergency rooms. So to talk more about the dire situation in some hospitals, I want to bring in the author of that piece, Ed Yong. Ed, thank you so much for joining us. If anyone is thinking, oh, we're turning a corner, maybe we can get back to doing the things that we used to do, maybe we can drop those masks, they need to read your article. And the other thing that I thought when I read your article is, even once these numbers start to go down, the healthcare system on a whole is going to be suffering from long haul syndrome because it's been devastated by the last 2 years. So I want to get specifics, right. Though. You spoke to healthcare workers in 11 different states. What were they telling you about the current situation in their hospitals?
So there's two big factors at play. One is just that there are so many patients. Yes, Omicron may be a little less severe than Delta, but that doesn't make it mild, and it certainly doesn't negate its extreme transmissibility. It is spreading so far and wide that it is still inundating hospitals with a lot of very sick people. Then there's the supply of healthcare. So many healthcare workers have already quit their jobs long before Omicron arrived, and now this new variant is causing record numbers of breakthrough infections among healthcare workers, which takes them out of play. It stops them from being able to be around patients. And these factors together means that hospitals are in a really bad state. And, the math of Omicron is very simple. More patients and fewer staff means worse medical care. And that's not just for COVID, it's for everything. I'm hearing stories of people sitting in emergency rooms with traumas and strokes and heart attacks for hours, sometimes days, waiting to receive care because there is simply not enough healthcare workers to provide it.
And Ed, you say that comparisons between last year's hospitalizations and the current number of admissions are misleading. Why are the circumstances different for healthcare workers this year?
So very simply, because there are fewer of them. Every wave leads to more and more healthcare workers being traumatized, exhausted, demoralized. And, often in the lulls between waves, a lot of them decide they have had enough and quit. And so the workforce is diminished compared to where it was 2 years ago. You can't just say that we could take the same volume of patients that we used to be able to take. It's simply not true. The healthcare workforce is reduced compared to what it was previously, and it is now also facing a record number of hospitalized COVID patients.
We've heard some recent statistics talking about kind of people who show up at hospitals and are tested for COVID, and then, they're positive, but they showed up at the hospital for another reason. And there has been some recent debate about, just maybe we should separate those two groups. But I want to ask you, who is showing up at the hospital? How do the patients being admitted to hospitals during this surge differ from those admitted last year?
Yeah, that's a great question. So a lot of people still are very sick with classic COVID symptoms. They have pneumonia, they need to be put on ventilators, they need oxygen to help them breathe. And then there's a much smaller proportion who are there for incidental reasons, like they might have broken a limb and turned up to hospital and oops, they test positive and they turn out to have COVID. Every healthcare worker I've spoken to has seen at least one of these such patients, but has told me that those are pretty rare. What's much more common is a large group of people who have chronic illnesses that are being severely exacerbated by the virus. They might have heart problems and now have heart failure. They might have diabetes and are now crashing. They might just be elderly and frail and are weakened enough by their infections that they fall and break something. A lot of those cases clearly would not have been in the hospital were it not for COVID, but they're being included within the car accident, oops, I actually incidentally have COVID group. And that's deeply misleading. What I'm hearing from healthcare workers on the ground is that the hospitalization numbers are real. We have more hospitalized COVID patients than ever before in the pandemic. That sounds bad, and it is bad for all the reasons that we've discussed.
And yet, Ed, there's a very interesting thing happening right now when it comes to just reporting on COVID-19. I think that reporters and the media at large is faced with the kind of a scrutiny that the media is talking about this, and you are writing about it and talking about the strain on our healthcare system, versus people who say, you know, you're fear-mongering. You are trying to prevent people from being able to live their lives. Those of us who are boosted and who have received both vaccines, you know, are well aware of the risks, but we don't want schools to shut down. We don't want, you know, places of business to shut down. And the media is contributing to this fear-mongering, which ultimately, Ed, as you report, has led to a drop in public support for our healthcare workers. I remember during the early days of the pandemic here in New York City, every day at 7 p.m., we would open our windows and we would bang pots and pans to thank our healthcare workers, and not just healthcare workers, our postal carriers, people who were working in restaurants delivering food and supplies to folks, our bus drivers and subway workers. But that's changed now. So what kind of effect has that had on them?
Yeah. I think it's added to the extreme demoralization that many of them are experiencing. You know, healthcare workers have talked to me about how during the day in their work, they can't escape the reality of COVID. They see dying people all around them, and they can't cope with the workloads that they have. And then, you know, in the evenings on social media or on TV or just in their communities, they see people living the fantasy that COVID is over. And that's just breaking a lot of them. You know, society is pretending as if the pandemic is over, and they are trying to get back to normal. But their decisions and the political inaction that we've seen means that healthcare workers cannot go back to normal. It means that they are continually immersed in this tragedy that is very much still going on. You know, you talked about the media's responsibility here. If we are continuing to portray it as a crisis, it is because it is still a crisis. Whether extremely privileged people who've been vaccinated and boosted, their individual risk may be lower than before because of Omicron, but the risk to society, the collective risk by this new variant, is still immense. And that collective risk is going to boomerang back on everyone who thinks that they're currently safe, because at some point you're going to go to a hospital with some health problem, not just COVID, but maybe a broken leg, you get into a car accident, someone you love has a stroke or a heart attack, and you're going to struggle to get the medical care you need because the healthcare system is collapsing in slow motion as we speak.
So to that point, you know, I want to bring back to how I opened this conversation with you about, you know, long haul syndrome for the whole system. And one of the lines that you have in your piece talks about the coronavirus, how it has plunged the entire healthcare system into a state of chronic decay. Did you speak to anyone about their prognosis for the future of the healthcare system, which wasn't the healthiest to begin with? I mean, one thing about the coronavirus pandemic is it really has exacerbated and put a spotlight on the areas of the healthcare system that were already flawed. Did anyone talk about how long the healthcare system will be suffering from the impacts of the coronavirus?
Yeah, it's really hard to predict. I think you're right. The healthcare system was already, struggling before the pandemic. Healthcare workers were already burned out. And that problem has got worse and worse with every successive surge. As I say in the piece, COVID's toll is cumulative. It's not just about how many patients are in hospital right now. It's the fact that healthcare workers have been dealing with this for now going on 2 years, and each wave hits them a little bit harder and takes more and more of them out of play. And as healthcare workers quit, the ones who are left behind face even worse conditions. They're more likely to be exploited by their institutions. They're more likely to feel abandoned by the public. They have heavier workloads. And it's worrying, right? Because this creates this horrible downward spiral where the system gets progressively weaker. I don't think anyone I spoke to felt that it was just going to immediately pull out of that once hospitalizations in this surge start going down. And I think we really need to, as a society, and especially for our political leaders, to grapple with what that means. That I think the consequences of this pandemic and this current surge are going to be with us for years, and if not longer. And as I've said before, this isn't just about COVID anymore. It's about our ability to get the kind of medical care that we might expect from the healthcare system that, is really buckling right now.
Ed, you've given us a lot of food for thought from your reporting, and maybe you said this, but the president has called this current surge in the Omicron one that is pretty much focused on the unvaccinated. Those are the ones that are turning up in hospitals. Did you find did that bear out in your reporting and when you spoke to some of these doctors and medical professionals, that the folks that are in the hospitals that are making it difficult for other people who may have other ailments to get treatment is because mostly the folks that find themselves in an ICU are those who have not been vaccinated? Or did you find in some instances that there are even vaccinated and boosted people that end up in the hospital and are also causing the strain on the system?
So my understanding is that, yes, predominantly the people who are being hospitalized for COVID are unvaccinated, and especially that bucket of people with very severe COVID classic ill symptoms. But there are still a lot of people in the chronically ill but tipped over into poor health bucket who have been vaccinated and perhaps even boosted. Like, the problem is that this country has a lot of chronically ill people who are more susceptible to the ravages of the coronavirus, even if they, in some cases, even if they have the protection, the immune protection of a vaccine. And, we can't just simply discount that. Like, there are a lot of people with pre-existing comorbidities in this country, and their health matters too. I think that, even for unvaccinated people, like, there's this sort of rhetoric I hear that that they are crushing the system, that some people are even suggesting, like, denying medical care to unvaccinated people. It just doesn't work like that. There are still important issues of access that have not been addressed. There are issues of trust that need to be talked about. The problem with the pandemic is still that it is a collective issue. It is one that affects all of us in society, acting together and affecting each other. And yes, it is true that unvaccinated people form a disproportionate amount of those in hospitals right now. But I think that rather than blaming individuals for what is happening to our hospitals, I think we need to look at the political decisions that have led to this virus spreading so rapidly and so openly and with such little opposition around the entire country.
Yeah, it's an excellent point that you make, and I'm glad that you made it, Ed, to talk about those folks who may be vaccinated but end up in the hospital as well because of the chronic illnesses that Americans face. And I say that because in the way that the discussions around coronavirus have become political, some people have used the fact that some vaccinated and boosted people end up in hospitals to suggest that the vaccines don't work, which then fuels people to say, well, why should I be vaccinated if a vaccinated person can end up in the hospital? And the point that you made is such an important one. I'm glad that you were able to make that, and it bears out in your reporting. Ed Yong, always great to have you on our show. We really appreciate your reporting. Thank you so much.
Thanks.